very happy day. And here I am to present a very small paper on psychoneuroimmunology and its application. Next slide, ma'am. Yeah. Abstract. Psychoneuroimmunology is a discipline. Ma'am, this, I couldn't see. Wait, ma'am, I'll just make it out. Okay, fine. Psychoneuroimmunology is a discipline that has evolved in the last 40 years to study the relationship between immunity, the endocrine system, and the central and peripheral nervous system. So, dear friends, you all may wonder what could be the relationship between immunity, endocrine system, and the central and peripheral nervous system. Let me tell you something about it. And here in immunity, basically our immune system is well developed in adult human body. This immunity will produce cytokine. Cytokine is nothing but it's a protein or peptide. So this protein peptide will give signal to endocrine system. Endocrine is purely with all hormones, and there is also some protein. And this protein will signal this endocrine protein. And again, in central and peripheral nervous system, proteins are available. All these three proteins will signal each other and will have some communication and link. There is a basic relationship between immunity, endocrine system, and the peripheral and central nervous system. So this could be a very short view of this psychoneuroimmunology, I suppose. And PNI research looks for the exact mechanism by which specific neuroimmune effects are achieved. Evidence for nervous immunological interactions exist at multiple biological levels. A number of researchers are available nowadays. They are gaining a clear understanding of the link between lifestyle and personality factors and immunology as research continues. Here, I would like to highlight one thing. Lifestyle, in the sense, you all may wonder, lifestyle could be like your even food pattern, your exercise. I'll just highlight one example out of it. Suppose if you take food pattern, like when you eat egg, milk, corn every day, what will happen? It will be metabolized as 5-HT, in the sense serotonin, 5-hydroxytryptamine. Further, 5-hydroxytryptamine will be metabolized as 5-HIAA, 5-hydroxyindolacetic acid, which is again acid which could trigger suicidal ideas or depression. So see, there is a very simple link between lifestyle and even the psychoneuroimmune system. See, whenever there is any lifestyle changes, what will happen? Immune system will also drop because the protein signals the immune system. Cytokine will be released, and there is some signal. And again, uh, in case of any very simple stress, also you can feel the same. And the next could be like personality factors. Nothing to do with personality factors because a personality factor in the sense it is like blood borne. So basically, for any personality disorders and factors and all, we don't have much treatment nowadays. Still, research is going on in that area. And immunity as research, it is very much continuing again. Next, next slide, ma'am. The main interest of PNI or the interactions between the nervous and immune system. Yes, the nervous and immune system has multiple interaction. Mind, body, we cannot separate into two. It is like hand to hand and like brother and sister or co-sister. The relationship between mental process and health. Just now I told what could be the exact relationship between your immune system and endocrine system and central and peripheral nervous system in couple of slides back. So in this manner, neurotransmitters, hormones, and even neuropeptides have been um, found to regulate immune cells, and those in turn are capable of communicating with nervous tissue through the secretion of a wide variety of cytokines. So just in previous slide, we saw what is cytokine. I gave a little bit of explanation about cytokine. So here I would like to talk about neurotransmitter. Neurotransmitter in brain, we have n number of synapses, and the end of the synaptic cleft we have bag-like structures. All bag-like structure will have many biochemical, like example could be dopamine, norepinephrine, serotonin, GABA, like n number of neurotransmitters were much involved, and certain neurotransmitters or even in gaseous form, even like carbon monoxide, like even nitrous oxide, uh, certain neurotransmitters or even in gaseous form. And here, again, there will be a protein signal between neurotransmitter, immune system. There is a link again. So everything is protein link, peptide link only between the immune system and all the psychic system of the body. Next slide, ma'am. Of critical importance is the effect of products of the central nervous system and nervous on the maintenance of the delicate balance between cell-mediated and humoral immune responses. And cytokines will be in many form, and cytokine 6 will be present in brain. That's why I would like to highlight one more thing here is, in case of fever, or in the sense any infection, like it be like because of bacteria, virus, or protozoa, or even fungus, when it invades human body, automatically fever or the body temperature will be increased because of hypothalamus involvement. Everything is because of interleukin 6 cytokinase will be released in the brain. So chronic stress affects significantly the function of the immune system. So you would all would have come across the term stress, stress, stress. Everybody is stressed nowadays. The two very chronic stress is again a crucial topic to talk about. And chronic stress, bottled up tension. Basically, you should talk. Here, I would like to talk about chronic stress. So before starting with chronic stress, you should know what is about stress. So stress, basically, we can talk about Hansel's model, in the sense general adaptation syndrome. So first, every person, every human being will cross three stages of general adaptation syndrome, like resistance, alarm reaction, resistance, and exhaustion. So in alarm reaction, either we will fight or we will fly. For example, a student want to go through an exam, in the sense either he will read day and night and he will pass and just fly off, or else if he doesn't want to fight for that particular exam, suddenly he may quit that exam, he may say bye, and he may simply take a mark called absent in that particular exam. So that is flight or fight response. So in fight or flight response itself, what will happen in the sense in part of stress, sympathetic nervous system stimulation will be there. It will be activated. Normally in human being, sympathetic nervous system stimulation will be very high in case of stress. One more thing, laterally you should know, adrenocorticotrophic hormone will release again cortisol. Cortisol will be very much high in case of stress. So what will happen here? Because of sympathetic nervous system stimulation from head to toe, all the what to say function of the internal organs and of course body and physiology, everything will be altered. Automatically, to compensate the sympathetic nervous system stimulation, parasympathetic stimulation will be activated, collaterally. When this parasympathetic system failures, if there is no activation at all, automatically mental illness like depression, anxiety, schizophrenia, or n number of mental illness, or we could pick from hand, I think, a person may develop in case of resistance and exhaustion stage. And again, the function of the immune system as well as modifies the evolution of a variety of skin disease. Yeah, here, chronic stress may lead to skin disease and mental illness. You all know, just now we spoke what is mental illness, how it how from sympathetic nervous system till the end of mental illness, enough picture we have seen. And here I would like to highlight this chronic stress could even develop skin diseases like even psoriasis. But nowadays, a number of pictures says, or scientists, they reveal that psoriasis cannot be called as a skin disease. It is just, what to say, replication or just multiplication of epidermal layer of the skin. So it could be like one more part, and as psychosocial interventions have proved to be effective in their therapy to some extent, because I'm a psychologist basically. So psychosocial interventions also can be useful for this chronic stress, even in case of acute stress. Next slide, ma'am. Yeah, the immune brain loop. Immune system and the brain communicate through signaling pathways. Just now we saw what is in immune system. We saw about cytokines and brain, cerebrum, cerebellum, medulla oblongata, brainstem, everything. And here brain and immune system will communicate because of protein signal and peptide, which is present in the immune system, of course, in the brain or in the central nervous system pathway. The brain and the immune system are the two major adaptive systems of the body. The two major pathways are involved in this crosstalk, the hypothalamic pituitary adrenal axis, AP axis, and the sympathetic nervous system. Just now I explained what is sympathetic nervous system stimulation and via the sympathetic adrenal medullary axis. The activation of sympathetic nervous system during an immune response might be aimed to localize the inflammatory response also. So in case of chronic stress or any other condition, even immune will drop. Immune will drop because of sympathetic nervous system stimulation. To just compensate this or to maintain the homeostasis of the body, parasympathetic nervous system stimulation will be there in the body. Next slide, ma'am. The body's primary stress management system is AP axis. The AP axis responds to physical and mental challenge to maintain homeostasis in part by controlling the body's cortisol level. Just now I told what is body homeostasis. And here cortisol level in previous slide, I've explained a little bit about cortisol, how far the sympathetic nervous system could stimulate the cortisol level, adrenocorticotropic hormone. Here, something I would like to highlight here is cortisol can be checked in blood, urine, even in case of our tears, sweat, earwax, saliva. In these areas, we can just check the cortisol level. And AP axis activity and cytokines or intrinsically intervened inflammatory cytokines stimulate adrenocorticotropic hormone and cortisol secretion, while in turn, glucocorticoids suppress the synthesis of pro-inflammatory cytokines. Molecules called pro-inflammatory cytokines, which include interleukin. Just now I spoke about interleukin. Interleukins, or it's a form of cytokine, which is released because of phagocytosis. Whenever there is some virus or bacteria or protozoa or fungus in the body, automatically our immune system will try to swallow that particular virus, because while swallowing, cytokine will be released in the form of interleukins also. So cytokines or many will be in many form. One form could be interleukin. Next slide, ma'am. Cytokine regulation of hypothalamic function is an active area of research for the treatment of anxiety related disorder. Is for anxiety related disorder, basically we talk about GABA receptor, GABA aminobutyric acid, and it triggers, and we give some anti-anxiety drugs which could calm the anxiety symptoms like apprehension, sweating, palpitation, etc. And cytokines mediate and control immune and inflammatory responses. Complex interactions exist between cytokines, inflammation, and the adaptive responses in maintaining homeostasis. Like the stress response, the inflammatory reaction is crucial for the survival. Next slide, ma'am. Psychoneuroimmunology applications. Let us see some of the applications of psychoneuroimmunology. Research said a great deal of light on many aspects of wellness and provides important research on stress. They all talk about stress much. Again, sympathetic nervous system stimulation should strike your mind when you hear the term called stress. PNI studies have found more correlations between life events and health effects. Even a simple stressful life event could trigger stress again, which in turn could affect your whole health. It could be like physical health and mental health. As PNI has gained greater acceptance in the scientific community, they're finding that emotional states can affect immunity and has been an important one, and research in this area helps us to gain a clear understanding of stress and its effect on health. Next slide, ma'am. Stress and health research includes studies that exemplify that we have learned so far through the field of PNI and supply us with important information on the link between stress and health. The basic concept of psychoimmunology is the concept that the mind and body are inseparable. right from the first slide, I just told the word, I uttered the word, mind and body are inseparable like co-sisters or brother and sister. It follows the stress affects the body's ability to resist disease. The brain influences all sorts of physiological processes once thought not to be centrally regulated. So every day we face stress. Let me throw one question: whether there is any medicine for stress? Can anyone tell me? Or you can just put in chat box also. If there is any medicine for stress or any tablets available.
So here we are having a question from Dr. Sampoornam. I hope we'll get so many answers from all of you. Come on, it's an interesting question. Let me answer from myself first.
Okay, ma'am.
Yeah. Please call me Ghazal, Dr. Sampoornam.
Yes, Gazel, please tell me. Any medicine?
According to me, I don't think there can be any medicine. There can be nature. Nature is the medicine, I think, for stress. It heals.
Okay. Like music, yoga,
Yeah,
like food.
yoga,
Yeah.
meditation.
Mm.
Yeah, that's the medicine for me.
Ma'am, may I try?
Yeah, sure.
This is Narendra Singh, actually.
Hello,
So,
doctor.
yeah. So, as the ma'am was talking about the medicines for stress, so there are various types of medicines available. Like for me, some of them, it can be like boosting up the levels of serotonin, which can be like SSRIs or the selective serotonin reuptake inhibitors. And there are some other class of medicines known as tranquilizers and antidepressants is a kind of an umbrella term which is used if we classify the medicines or the drugs for the stress.
Yeah, thank you, ma'am. As he told, antidepressant, tranquilizers, and all, those who have mental illness, we put not for all stress clients like you and me. Every day we face stress, yeah, we cannot put that particular like. Why do you go for that extreme antidepressants and tranquilizers?
I would
And
add a
yeah,
note here, if I may.
yes, sir.
So, I have seen many psychologists prescribe their patients with SSRIs, and in some cases, it has led to serotonin syndrome, which might actually harm the patient more than it helps them. So, I mean, these medicines are not the answer sometimes.
Yes, you're right, sir. I agree with your point. What do when psychologists will recommend for medication in the sense whenever there is any socio-occupational dysfunction along with that, if they cannot perform their daily activity like eating, sleeping, or bathing, in such case only we prescribe drugs. Otherwise, we don't prescribe drugs for stress. As you said, there is no exact drug for stress. Okay, next, but vaccines were available. Vaccines were available. Let me talk about vaccines here. Next slide, ma'am.
Before
Yeah.
that, Dr. Erma also raised her hand. Yes, Dr.
Yes,
Erma.
yes.
I guess she wants to add on. Sorry for the
Yes.
interruption, Dr.
Okay.
Sampoornam.
Okay,
Yes.
thank you for a very nice presentation, but one comment only about the prescription of medication or neurotransmitters. It's not the job of psychologists, because psychologists never prescribe any type of medication. It's a job of interaction of psychiatrists. I wanted to mention about this.
Yes, ma'am, you're right. We recommend that particular
Because the
client.
psychologist in any country, yeah, recommendation it's possible, but it will be with collaboration with psychiatrists, because it's not your direction to recommendation with psychiatrists, because there's a in any country where takes the same issue, yeah. And another question about the second and third stage of stress. Can you provide more details about the resistant stage and third stage, which is very harmful for health? Thank you.
Okay, thank you, ma'am. I'll talk about that also. And yeah,
Ma'am,
yeah.
I would like to add something as the former has spoken about it. So the
Yes.
main difference actually between a psychiatrist and a psychologist, it can be a psychologist provides a lot of therapies, but it can be a talk therapies or different types of therapies to help the patient overcome and lead a better quality of life. But the therapies does not include medication. It can be oral medication or intravenous or the vaccines, as you mentioned. A psychiatrist generally prescribes medications. So
Yes,
yeah, that's what I wanted to add.
Okay, ma'am. But in Indian scenario, I agree with all your points. In Indian scenario, I would like to add one more point. Basically, in India, what they'll do for screening and everything, they'll send to a clinical psychologist, and they'll go for all tests, and they'll just tell whether they need treatment or not, further treatment or not. And as you said, psychiatrists will take care of all the prescriptions and medications and all. That is present scenario in India. And of course, most of them, they come and see all the counselors and psychotherapists. We have separate courses in India for counseling and psychotherapy and all. And of course, clinical psychologist alone can give all noted or referral services. Not all psychologists, that too in India, not all psychologists are recommended for giving any referral services or any, or any report. Only clinical psychologists, that too registered psychologists, are allowed to give all reports. Okay, then any more question, please?
Any question? Yeah, you are absolutely true about the clinical psychologist and neuropsychologist too. But do you have psychologists with a certificated, I mean the Euro certification of any international certification, or it's not recommendation, it's not we don't use a certificate, and any clinical psychologist can work with a patient based on psychotherapy or any type of psychotherapy. So it's obligation to make this to have a certificate or not?
Yes, ma'am. Only certified person can be a psychologist. A lay person cannot be a psychologist in India. I do understand in such a way. So certified person alone can be a psychologist. That clinical psychologist can go for like referral services and other reports in India. Gizel ma'am, shall I proceed?
In
Your voice. Yes, ma'am.
generally,
Yeah, sorry for the interruption, Dr. Erma. The voice is breaking from your side.
They are the obligation to have international certificate.
Hello.
See,
Yeah. Dr.
I
Erma.
mean, it will be.
Yeah, let me just message Dr. Erma.
Sorry, I must.
The voice is breaking.
Okay, because
from your side. Please, Dr. Erma, as Dr. Sampoornam is like taking questions, please write down the question in the chat box if possible, as the voice is breaking from your side.
Ma'am, shall I proceed, ma'am?
Yeah, Dr. Sampoornam, sorry for the interruptions, but Dr. Erma is asking a question, I guess. The question is from you. And Dr. Erma, will you please write the question in the chat box? And thank you so much, Dr. Sampoornam, for taking questions in between.
Thank you, ma'am. Thank you. It's like interactive session only, ma'am. So in
Yeah,
India, I'll just give her the answer right now itself, ma'am. In India,
okay.
we get training from NIMANS and all, ma'am. NIMANS, they'll give training certificate and all to be a specialized person in cognitive behavior therapy or behavior therapy. In any one area, we can get training and we can practice it. It is not necessary for all clinical psychologists. Like me, only simple psychologists can use that. I'm only basically, I'm just MSc in psychology. That's it. I've done my PG program in psychology. Basically, I'm a nurse. I'm doctorate in nursing. So just out of my interest, I've taken this subject. So in such case, we can go for training and I can be a specialized person in the particular area. I can give CBT for all suicidal clients if I'm a trained person from NIMANS or any other reputed institution in India. That could be the right answer for her, because her notion is with the European Association, and our notion,
Yeah.
Indian notion, is in this way. Shall I proceed, ma'am, with my talk? Shall I proceed, ma'am?
Yeah, please.
Yeah. There are
Thank
effects
you.
of, yes, ma'am. There are effects of psychological factors on many diseases like rheumatoid arthritis, diabetes, hypertension, heart disease, inflammatory bowel disease, and etc. Diabetes, in previous, like couple of years back, they said it is not purely hereditary disease. It is only purely because of stress. So yeah, hypertension can be again divided into two, like essential hypertension, systemic hypertension. And here essential hypertension is only because of stress. Heart disease and number of heart diseases are available. I mean, easily available. I could say even like getting brinjal from a market. So every day we should take care of your mental health. Stress-free life alone can prevent all these diseases. Next, ma'am. Stress vaccine. Yeah, something new. In 2018, a research team led by Christopher Lowry, integrative physiology professor at the University of Clarendon, published a study showing that the soil-based bacterium called Mycobacterium vaccae decreased stressful reaction in mice. They have conducted research in mice, animal study. The researchers injected the rodents with Mycobacterium vaccae prior to exposing them to a stressful event. And the shots both prevented post-traumatic stress disorder like syndrome in the short term and diminish stress reactions later on. See how far this mycobacterium is very effective in the sense, out of all the vegetable soils, they'll pick all the mycobacterium and they'll inject, and it again, it'll, you know something here, 80% of the immune is in the gut. So when you boost the immune of the gut, automatically nothing can enter, like PTSD or even a simple stress or even severe depression or mild depression, nothing can enter into your body or mind. So this is about stress vaccine, newly developed, and very soon, like a decade, we all will receive stress vaccine very soon. It will be available in all national vaccine schedule. It is very soon. It will be in human study and of course in vaccine schedule. So everybody will be stress free after the stress vaccine, I suppose. Next, ma'am. Yes, next, very advanced is fecal microbiota transplantation. Yes. So what do they do from donor? They take from the fecus or from the gut, they take all microbial composition from healthy donor and they transplant it to all, I mean, all recipient who's having mental illness. So after transplantation, they observe that mental, I mean, psychiatric illness and certain symptoms like severe psychosis and delusional disorders and all, it is just vanishing and diminishing day by day. So this could be a very good study, a trial. It's going on, and again, I think so. This will be in human trial also very soon. So with this, I'm completing my next slide, ma'am. My talk.